Hi, I'm Dr. David Goldbloom, Senior Medical Advisor at the Center for Addiction and Mental Health, and I'm here today to talk with you about youth mental health. Right now, an estimated 1 in 5 children and youth in Canada, that's 1.2 million young people, are struggling with a mental health challenge. Some of the common problems include anxiety, depression, attention deficit hyperactivity disorder, eating disorders, substance abuse, and less commonly, schizophrenia and bipolar disorder. It can be challenging for parents and even for a healthcare provider to diagnose a mental health problem. Is it worry or anxiety? Sadness or depression? Is it the normal ups and downs of typical development or the telltale signs of a mental disorder? It's normal, of course, to be worried or sad at any age. For a diagnosis of a mental illness to be made, symptoms of anxiety or depression must also be accompanied by a range of characteristic changes in things like sleep, energy, appetite, and even thought patterns, as well as by some impact on how that young person functions, like a worsening in school performance, or in getting along with family members or peers, or even attempting suicide. Another important element is how long symptoms endure. As a general rule of thumb, if symptoms and associated impairment are lasting for weeks to months, as opposed to, say, hours to days, then that's a cause for concern. If depression, for instance, lasts most of the day and endures for a period of longer than 2 weeks, a clinical assessment would be the next step. Symptoms of anxiety that last for more than, let's say, a couple of months are certainly worth inquiring about. Any expression of somebody wanting to hurt themselves or even kill themselves should lead to an immediate clinical assessment. And of course, if symptoms are getting worse rather than getting better, becoming more intense or more overwhelming, then you should be doing something about it. Family awareness and early identification are often the first steps to effective treatment for children and youth with mental health disorders. It's best to be honest with siblings and other family members about a child's illness. That way, your child has several sources of support and understanding. And intervening early can lead to a better outcome. All too often, families wait, either because of poor access to services, lack of understanding, stigma, and the hope that it's just a phase. For more information about youth mental health, you can contact Access CAMH. The Ontario Mental Health Helpline is open 24/7. Kids Help Phone provides direct support. And finally, Children's Mental Health Ontario is a valuable resource. I'm Dr. David Goldbloom. Thanks for watching.